Welcome to our podcast, The Better You Are, The Better You Are. Whether it is physically, mentally, or spiritually, when you know better, you can do better. And when you do better, you'll be better. On this podcast, we share knowledge, expertise, opinions, and experiences. All things that can help you to change the game. By the time we're done, it's hard for you not to be encouraged. So join us. The better you are, the better you are.
So let's start off with some statistics. According to the American Cancer Society, breast cancer is the most common cancer diagnosed among women in the United States, and it is the second leading cause of death from cancer among women, only lung cancer killing more women each year. Over 300,000 new cases of breast cancer will be diagnosed, they predict, in 2024. 1 in 8 women will be diagnosed with breast cancer in her lifetime. And unfortunately, over 40,000 deaths related to breast cancer are expected. As with many other healthcare concerns, Black women are affected more aggressively, often with this condition. Black women are 40% more likely to die of breast cancer than white women and are twice as likely to die if they are younger than 50. Okay, I'm thoroughly excited to have our discussion on breast cancer today, and we have 3 fabulous speakers to be with us today. First, we have Valerie Dean. Valerie Dean was born and raised in Birmingham, Alabama. She is currently living in Pinson, Alabama, and is the wife, mother of 2, and the proud grandmother of 2 grandchildren. She works as an accountant for a major utility company. Her journey with breast cancer began at the start of the COVID pandemic when she became the caretaker for her mother, and continued through July of 2021 when her husband was diagnosed with Parkinson's disease. 2 years later, she was diagnosed with stage 2 invasive ductal carcinoma breast cancer, despite no known family history. Her diagnosis began with a fall that turned into a life-changing revelation, sparking a journey filled with realizing the faith, strength, and courage she didn't even know she had. We also have Letrice Johnson. Letrice Johnson is a 3-time cancer survivor. She has a diagnosis of Hodgkin's disease twice, as well as breast cancer. She has been cancer-free from her last bout for 14 years. She and her husband, Paul, live in Chicago. And when I reached out to her, she said she would be honored to be a part of this discussion. And last but not least, we have Dr. Monet Williams Bowling. Dr. Bowling leads the breast cancer team at Hendricks Regional Health in Indiana. She is board certified in surgery and fellowship trained in breast surgical oncology. She hails from Decatur, Georgia. She attended Spelman College, where she obtained a BS in biology, and then went on to Indiana University, where she earned a master's degree in medical science and a medical degree. Her general surgery training was completed at Indiana University, and she completed her fellowship training at the University of Texas Southwestern Medical Center in Dallas. She is highly renowned in her field and a passionate crusader in the fight against breast cancer. Dr. Bowling is happily married to Don Bowling II, a teacher and varsity boys basketball coach at a local high school, and she is the mother of twin boys and a young daughter. She describes her family as the pride of her life and her most rewarding accomplishment. She enjoys creating wonderful humans that will contribute their gifts to the world. She always has a welcoming smile, and despite her busy work and personal life, she did not hesitate to agree to be a part of today's program, as did Valerie and Letrice. I thank you all for being here today, and I'm excited to get on with this discussion.
So when I went to the team at UAB, they have like this little angel team, and the lady came in the room with a little angel bag with all of the stuff. And this is to show how in denial I was, because when she brought the little bag with those stuff that, just little trinkets for breast cancer patients or whatever, I looked at her, I'm like, you can take that back. This is at that time. I'm still thinking I need this. But yeah, from that little lady to the nurses, everybody was just on point. And also, I was told they even suggested to me get you a team, which I had a team anyway. A lot of although my mom couldn't be there for me physically or mentally, and Travis couldn't be there for my husband couldn't be there for me physically, and I had a team of my girlfriends. I mean, they made calendars, they set up my appointments, they made, okay, who's taking her for this treatment,
Amen.
who's preparing meals. And my kids, my daughter, she has moved to Georgia now, so she would come home on different times to, take me for my treatment because they had her, my son, everybody in the little group to carry me where I needed to go. And I was like, carry myself. No, we will not. So they were my rock. And like Latrice, God was there with me as well because there were several days because going through this is a lonely feeling. I tell anybody, you're lonesome because nobody can feel what you're feeling when you're going through this, when you're going through the treatments and dealing with the side effects. And so it was kind of hard, but knowing that I had that team and that tribe of people behind me that kind of pushed me, and Latrice was one of them. I actually was introduced to her through Lauren, your husband, Dave,
Mm-hmm.
and he connected us, and she would call me and invite me, and we would just text, and she would tell me what to expect, and that's the type of stuff that got me through. It really did. And I appreciate all of it. I
God
do.
bless. Yes. Again, what's the saying? You can't really know a person till you walk a mile in their shoes. So
Exactly.
we walked in the same shoes. They may be a different color,
Yeah.
a different style, but they're.
Yeah.
Yeah.
And was it helpful reaching out to somebody who'd been through the process to say, I distinctly remember I had at one point in my office, I was a director of a program. I had 5 women with breast cancer. One was getting chemo, one was radiation. I remember the one who was getting radiation because you're a medical doctor, you know a lot of things, but she just cried. She said, I cannot go in there one more time and stay stuck in this position. You have to sit, in a certain position for a length of time. And I remember just holding her and saying, yes, you can do this. God is with you. He knows the number of hairs on your head. He knows the course.
Right.
But,
Right.
but it impressed on me, you go through medical school, you experience a few things or you have friends, but just the way she said, I can't go in there one more time and just stay in this position. So to know that people get through it and help. I remember, Letrice, you told me a story. Somebody came and showed you, grabbed you, took you into the bathroom, threw up their and said, here's what my new breasts look like.
She did. I had just met this woman through the Susan G. Komen walk. And we would train together. And Terry, she's a beautiful spirit, and like I say, walk a mile in the shoes. And I was concerned, and she's like, "Girl, come on." And she's like, "Here, look, these are mine. They're mine."
I had a girlfriend as well.
I have seen my fair share, but yes, I've seen my fair share in malls. I've seen my fair share in hallways. Patients would walk up like, "I'm done." I was like, what is happening right now? Somebody's going to think I'm a pervert. Yes.
Amen.
This is great. I'm so happy.
Yeah.
So it's wonderful. I just want to circle back. I had to take my glasses off because I have been flashed in many a place. So I totally get that. I just wanted to go back to risk factors. I know we were bringing up risk factors and things to think about. I think as we have this conversation about our community in general, one of the things that I really wanted to stress was body mass index, which I don't necessarily agree with how the BMI is created, how it is calculated, what it is. But there are facts that we need to be very clear about adipose or fat carrying cells. And I want to be very, very clear on that, that 30 minutes of exercise, 3 times a day. 3 times a week, even, not even a day, 3 times a week decreases your chances of getting breast cancer by 18%. Those are facts. That this is not like a made up number. No one pulled it out of anywhere. And the reason that it works is because you're decreasing those adipose carrying cells. Adipose also carries estrogen, and we don't talk about that enough. The more estrogen after menopause that your body is exposed to, it's like taking exogenous estrogen. You are a factory for setting up this kind of transformation of your breast tissue. So yes, I know that these hormones make our skin great. They make us feel great. Our moods are great. They're wonderful. But long-term use of estrogens, all of those fat-containing cells, they are issues. So losing some weight helps in so many ways. And I don't think that we stress that enough. I have patients who get very upset. My medical oncologist on our team, he tells everybody, oh, you need to exercise and you need to go out. And they're like, I'm going through chemo. Don't you tell me to exercise. Don't you tell me what to do. And I'm like, he's only saying it because every little bit of decreasing those adipose tissues that you have decreases the amount of estrogen in your body. And so I try to kind of like, I am always the glass is half full. So I will tell you, I am the Pollyanna to my medical oncologist, the glass is half empty. So I am that person because it is always half full and there's always another side of the coin. But losing weight is huge. Looking at your family history is another because you want to be prepared for like what could possibly come your way. I wish I could tell people that smoking caused breast cancer. The only reason I wish I could tell them that is because it would cause more people to stop smoking, because I make deals with patients all the time. I'm wheeling and dealing in my office. You got to stop smoking if you want your reconstruction, because nicotine decreases skin healing. If you can't get the skin to heal, then I can't send you to the plastic surgeon, and you really need to stop smoking. But it is the cause of lung cancer. So stop smoking anyway. Stop smoking anyway, because it is the number one cause of death for women is lung cancer. So that's my soapbox for smoking. It does not cause breast cancer. It doesn't lead to breast cancer, but it definitely leads to decreased wound healing.
But can I add it does cause so many other things like cervical cancer and throat cancer and skin cancer and small babies and abruption and SIDS, sudden infant death syndrome. So smoking is not good for you or anybody else, but go ahead.
That's not my wheelhouse, but I was waiting for you to jump in. That's not my wheelhouse, but I was waiting. I was like, she's going to say it. She's going to say it. So just to be clear, so decreasing your body fat, exogenous estrogens, or like losing weight, just kind of decreasing the amount of hormone, because it's the duration of hormone therapy. It's not just taking it one time. It is like, I have patients who come in, I have no risk factors. I don't know why I have this breast cancer. Well, you've been taking hormones since you were 25. And for whatever reason, nobody ever told you to stop. And so now you're 60 and you've been on these hormones for 35 years. Like, what are we doing? So it's the duration of that hormone exposure that is the issue. Then I want to be.
Dr. Boland, can I ask you a question?
Yes.
Now, my oncologist had me on a hormone blocker, anastrozole, and I've got to take it for 5 years. So what is that doing for me?
Exactly. Yes, I'm going to put my glasses back on for this one. So let me put on my doctor hat and put my glasses back on. So what Valerie is speaking of is aromatase inhibitors. So there's a large class of that medication. For patients who are premenopausal, we give them tamoxifen. That is what Letrice took. What Valerie is talking about is aromatase inhibitors, and they are hormone blockers for women who are postmenopausal. There are lots of things that these cause. Most assuredly, patients will get some version of a hot flash, a night sweat, a mood swing. There is even chances that people can get breakthrough bleeding. There are other things that can cause issues and problems. Valerie, what you're going to find, and I know they told you 5 years, but I think that the oncologists say 5 years because they don't want to tell people what we know now, which is it could be 10, and they don't tell you that. because
Well, they
nobody
tested-
wants to be on it for 10 years or admit that we have people taking it for 10 years because of all of the side effects.
Yep.
They did give me a test to see if I would need to go beyond the 5 years, and the
That is
test
the
came back.
breast. Excellent. That's great to hear.
Wow.
I'm so happy people are doing it
Wow.
earlier. That test is called the Breast Cancer Index. It's BCI. It's called the Breast Cancer Index. And usually it's just kind of come into vogue that people are using that test. We used to use that test for people when they get closer to the end of their 5 years, because we've been using it for maybe like the last 2 or 3 years since the pandemic. That we can test your DNA, and what it tells us is that you're not going to get any additional benefit from being on that hormone blocker, that anastrozole, for longer than 5 years. The reason why that test was invented is because we have a lot of people who quit their therapy because they can't stand the side effects. And the side effects are significant. They're not nothing. Your loss of libido, your loss of vaginal moisture, depending on what time that you have to go on these meds, and also doctors who do not want to talk about what it is to be active sexually after the age of when your cancer was diagnosed. That is a problem. We have a very difficult time. You're talking about difficulty in explaining cancer and delivering bad news. And I don't think Dr. Lauren has an issue talking about sex because she deals with this all the time. But oncologists and breast surgeons, they'll dance around this and they won't talk about it because it makes everyone uncomfortable. We have to talk about these issues because these are the things that cause people to stop their therapy. And if you're one of those people that those drugs can help prolong the length of time before you see a recurrence, if you're going to get a recurrence, then you need to be on those medicines. And so we need to be very upfront and very honest. So I am so happy to hear you got your BCI test and they told you it's just 5 years, because when people know they have a stop point, like, okay, I can do this. I can do this for a year. I can do it for 2 years. I know at 5 years, I'm going to take my last pill and I'm never going to have to pick this pill bottle up again or pay for it because it's not cheap. It's, it's all of those things. I think that people do better if they have a start and a stop to what is going on. Just like Dr. Lauren was talking about her patient that, someone in her office who was like, I just can't go in there and sit in that position one more time. And sometimes all someone needs to hear is that you can. You can do it. You can go through another day, because that's going to get you to the 10 more years that we need after this. That'll get you to the 20 years after this. That'll get you to your grandchild being born. That'll get you to, the marriage that you're living for to see. You don't know what's possible until you take that step.
Yeah.
And to hear from other people, I went through that step and here I am today. So that's what I think the value of linking people with people who've gone through it as well.
Exactly. And, earlier we talked about communication and talking about things. I remember I told Valerie, I said, hey, if you need like a vaginal moisturizer, I got a great company for it. It's the communication, because if you think that, the light switch and everything is going off because of this chemo, because of this radiation, it doesn't have to. We need to communicate about what we know, share the information.
Share the information.
Share the information. Yes.
I have had to become a lubricant expert because nobody wants to have this conversation with my patients.
Yes. And women, you all that are watching, I need you to talk with your gynecologists. Discuss with them the things, your most intimate details of things that you wouldn't discuss with anyone else. They're your doctor. They're going to know what treatments or they'll have the knowledge.
Or at least help direct you to people who can help you, but they should be comfortable in those conversations.
Exactly.
See, and that goes back to getting a gynecologist that you trust. Because if you have one that you don't trust or don't,
feel comfortable talking,
you're not going to talk to.
Nope.
You're not going to tell.
Exactly. And Valerie, yes, the anastrozole, I think we talked about that too. I was actually on it for, I believe, 11 years. So so I'm off of it now. But the side effects and everything. Yes, we talked about that, changing nightgowns.
Before we end, Monet, let me ask you two other potential risk factors that certainly I'm getting a lot of questions about: breastfeeding and breast cancer, and chemical hair dyes, or more importantly, in my community, hair straighteners and cancers. I know there's controversy. Just what are your thoughts on?
I think that there's a lot of controversy, and I think this is where we have got to be involved in research. I think that people need to be very honest about people being the industry, the chemical industry that straightens hair, that does all of this, because this data about people getting hair straighteners and the association with gynecologic cancers, supposedly, and that's allegedly, the data has been out there and no one ever reported it. So I don't know that data specifically. I have not heard of that data as it specifically relates to breast cancer, but I do think that it warrants a conversation about the medical industry and research and how we better serve patients, because people have been getting perms for a very long time.
Amen.
And those cells and how those cells change and what that becomes is very important, because I think that if people are educated, it's one thing to know that something causes cancer and you do it anyway, right? We know that smoking, nicotine, vaping causes lung cancer, and people do it anyway. That's a choice. That is a choice. But it's another thing to know something or not know something, and you're using it thinking that it's safe, and it's not. And so I think that if we know differently, we make different choices. That's the first thing. Breastfeeding, actually, for most of what anyone has been taught, is protective against breast cancer. And the reason being is that there is kind of this shutdown of your estrogen capability. That's why having pregnancies is said to help, because it changes your estrogen kind of on and off, like estrogen surges. Becoming pregnant and having children and having breastfeeding is protective for someone who is at risk for developing breast cancer. And those are kind of the reasons. I think that as Black and brown women become more involved in research, we will know more data, because I have to be honest, a lot of the information that we know is not based off of people that look like us. And that goes for my plug for every woman who is undergoing, pap smears and pain receptors, and what it takes for women to have biopsies and have a gynecologic exam. We were the guinea pigs without
Amen.
being acknowledged or anyone telling us that we were the guinea pigs. And so I think that all of those things are very important. How those medications affect women of color, because we have found out over the years that hypertensive medicines are different. So are the aromatase inhibitors different? Does it affect women of color differently? I was questioned a long time ago. Do I think that being Black or brown is an issue for the development of breast cancer? And for so long I said, oh, people are people, and we're all made up of this DNA. But as I go through life and I realize that women of color die sooner, are diagnosed with a more advanced disease, I have to believe that somewhere in our makeup, it doesn't necessarily have to do with just the melanin, but somewhere in our makeup, there are some nuances and some differences to people that would cause a more advanced or a more aggressive type of cancer. Not the cancer in general, but more advanced and definitely more aggressive. So all of those things go back to, we need to be involved in research. We need to be asking the questions that get to the correct answers, and we need to be told the truth.
Amen. And I will say, certainly in maternal fetal medicine, part of the issue is the biology, but 80% of the issue are the social factors surrounding it. And then I come into care later. I come to get my mammogram later. I come in because of numerous factors. And I think just like we found out with COVID and we found out with everything, if it affects people, it's going to affect people of color even more because of all the stresses that we go through from a young age on up, and weathering and other things. But which reminded me, I wanted to give this one story of a friend that I have who's an OB-GYN doctor, whose mom had felt a breast mass or something and went to her doctor, and she said, you need a mammogram. And she called up to schedule the mammogram. Her mother did. And she felt like the people were rude on the phone, and she hung up and she said, I'm not going in there. And then she thought about it. She said, I'm only hurting myself. They can be rude to me, but I need to go in here and get my mammogram. And I think as people of color, oftentimes you are, for whatever reasons, perceived or feel insulted or other things, but don't let that hinder you from finding a relationship with a good doctor that you enjoy. But even if you don't, keep on pushing through, going in and getting the studies that you need, because I think that's a factor in a lot of the later presentations and worse outcomes and increased risk of death associated with so many things, hypertension and diabetes and other things in racial disparities, that a lot of it, there's maybe genetic factors, but there may be social factors as well. Please don't let the social factor be an issue.
Mhm.
Great, excellent point and a great way to end. Do not let the social factors be an issue. And I just appreciate the honesty in this conversation from Valerie and Letrice. Thank you for sharing your story. I mean, there are just so many ways that people could learn just little nuggets from both of you, because your stories represent a very wide range of what goes on for people in terms of meeting doctors, meeting your team, kind of your team protecting you and taking care of you, to meeting people who, I don't even know why I'm here in your office and I need to meet another team, because you are the advocate for your health and you should be in charge of what goes on. And I tell you, I meet every one of my patients and I offer them a sheet. And I said, this is a long journey. Mm-hmm. We are either going to be in this together or we're not going to be in it at all. Mm-hmm. And if you need to get a second opinion, please, I have 6 doctors who I can call personally to get you into. Because if we don't mesh well, I guarantee you one of the people on this list is perfect for you. And that part of everyone's journey is very important. It's a long list. It's one of the reasons I went into breast, because I didn't get to treat them and treat them. I didn't get to just kick people out. I know their families. I know your vacations. I know where you go. I know who you talk to. I know your friends because you bring them in. This is a long journey and we're on this together, and I don't get to kick you out. And I love that. And so let's make sure that you are comfortable with that journey the whole entire time.
Amen. What a blessing you are, Dr. Bowling. And and hopefully, as well as you, Letrice and Valerie, thank you for sharing your story. Thank you all for being here. Thank you for this discussion. And we're just prayerful that it helps someone on their journey today.
Thank you, Lauren. Thank you, Dr. Bowling and Letrice, because Dr. Bowling, you've shared some insight with me that I did not know. And,
I have to say too, I love, Monet, I teach residents and people the power of why. I can tell you do something, but if I tell you why you're doing it, I tell you why you need to lose weight and why that's going to help you and why you need to get out there and work when a walk, maybe even just around the block because you're not feeling well from your chemo, because if I reduce the fat cells, I reduce my risk of estrogen carrier. If people understand the why behind it, and that's what I love about you and how you have helped us all today in explaining the why behind so many things. So thank you again for being here. I love it.
My pleasure. I tell you, it's so funny because my whole life, I wanted to be a doctor. That's all I ever wanted to do. I had to be very honest about that. And so when I tell people, they're like, how did you get into this? How did you do this? And what got you to breast surgery? I wanted to be a plastic surgeon because I wanted to make everybody pretty. And I really wanted to be a plastic surgeon. And my breast surgery mentor said, you have so much to offer the world. And you have so much to offer patients and families. And when he said that, he knocked on someone's door and said, you're going to go in and tell this patient they have breast cancer. I was a medical student, never delivered bad news in my entire life. Literally, he walked in the door. The patient, her brother was in class with me for medical school. It was like the most life-altering experience and actually got me on the path that I'm on today. But I think about the why, Lauren, and I just love taking care of people's families. And that's what we do, right? We get to take care of people's families. And what an honor and a privilege to do that every day. It is an honor to take care of people and to also educate them. Because if we know better, we do better.
Right. Amen. The better you are, the better you are. Yes.
Amen. We know better, we do better. And we've got to figure that out, right? Amen. So what is it that what's that one signal that people need to hear so that they do better. And those are the things that I love about what we do.
I think a great place to end. Thank you, ladies.
Thank you so much.
Thank you.
Thank you for listening in today. Weren't you inspired, encouraged, and uplifted? We hope so, because we're praying the best for you. Join us again next time for more betterment, because the better you are, the better you are.